Why is integrative lifestyle medicine based approaches the future of chronic pain management? Well, I certainly think so. And this is the reason why I think an integrative approach is going to make the difference for our patients. I must say that in this video, I will completely accept that it's not going to be the answer to every person's pain. And there are certainly some disadvantages and advantages to this. But I think that this is the right way forward for our patients and for us to be practicing in a person-centered manner. Well, what do I think are the advantages of this kind of approach? First of all, it's holistic. Now, I know that's a really overused word, but maybe you could call it a comprehensive approach. It effectively is taking the whole person into account. It ensures that we identify and understand every aspect of their life. And that means that you are going to ensure that the plan that you make is personalized for that patient. The second is this kind of approach allows us to get to the root cause of problems. And there is no way that a conventional medical approach offers that optionality at all. Integrative approaches are going to allow us to ask the questions that allow us to understand the root cause approach, and that is another big advantage of this particular approach. The third advantage is patient empowerment. By going down this person-centered route, you are going to ensure that you are making the person an active part of the plan, and that there is some responsibility that is with the patient itself. And we know that chronic pain is a long-term condition, and in today's world, in the UK, we know that long-term conditions have a part responsibility from the patient as well. So making the patients aware of what they can do, giving them the confidence that they can do it, giving them the skills and the clarity on developing a plan, all of this is going to ensure that they feel empowered to look after themselves. And that's a big step forward. The fourth most critical part of the advantage is essentially the lower risk of side effects. A lot of these complementary approaches are effectively going to have a lower risk of side effects than your traditional, conventional, mainstream medical approaches. What are the disadvantages of an integrative approach? And when I say an integrative approach, it usually means a combination of conventional medical treatments, which is available in most primary, secondary, or specialist care sectors, along with the complementary therapies that are often not provided in these sectors. So one of the biggest disadvantages is access. Realistically, it may not be available close to where the person is, or it may not even be available in the geographical area. The second is cost. Because a lot of insurers are not going to cover it, they are not going to be able to pay for it. And that means that often these are out-of-pocket expenses for patients, which might mean they don't adopt it or do it that frequently. The third disadvantage, and I think it's a relative disadvantage, is the lack of high-quality evidence. Now, this is something that may be more so for certain complementary therapies and less, which is now being changed by neuroscience. But in some ways, it's difficult for some of these techniques to be gauged by the same kind of randomized controlled trials that you can do for a surgery or a tablet. It's not possible to do a double-blind randomized trial of, for example, when you can do it for a drug, it's difficult to do it for some of the complementary based techniques, especially where touch is involved, like massage or osteopathy or chiropractic or physiotherapy. These are difficult places where you can do a sham or a blinded approach. So you can see that there are some significant disadvantages to this technique. But I hope that the advantages overwhelm. And right now, I think given the problems that we have with conventional medical techniques in terms of drug-based side effects or surgeries that don't seem to last for long or too costly. An integrative approach that combines the best of both the conventional approaches and the lifestyle medicine based approaches is the right way forward, and that is why I think that should be the way we support our patients. I hope you enjoyed listening to this video. I look forward to seeing you in the next one. Thank you for watching the videos. I hope you're getting value from them. Don't forget to subscribe and hit the bell button for notifications on when the next videos are to be released.